Did you know that up to 88% of people who complete dialectical behavioral therapy, who meet the criteria for borderline personality disorder, no longer meet the criteria for BPD after completing the treatment? My name is Caitlin, and welcome back, Retired Good Girls, to an episode of Not So Dumb Blonde. Before we dive into our interview with expert Mallory Gollick, where she talks about dialectical behavior therapy and how it can be beneficial, in particular for women in relationships, I want to go over some stats to really share how effective DBT really is. Those of you who have been listening to this for a while know that DBT is one of my favorite healing modalities out there, and it's something I'm extremely passionate about. Before we dive into this episode, I thought it would be really beneficial to share with my audience just how effective this treatment method is, because I believe it really works and healing is possible. So like I said, up to 88% of people who complete, I think it's a year of dialectical behavior therapy, can go into full remission. The reason why this is such a big deal is that BPD is such a stigmatizing diagnosis, and up until recently, people have thought that that borderline personality disorder is completely untreatable. There is no cure. If you have it, it's basically a death sentence. That is absolutely not true, and the evidence proves it. Neuroimaging also shows that there is a decrease in the size and the activity of the amygdala in persons who've completed a course of dialectical behavioral therapy and who meet the criteria for borderline personality disorder. This is important because the amygdala is exactly what is responsible for emotional regulation and kind of that fight or flight response in people who get triggered, and especially in people who have complex trauma or borderline personality disorder. So it doesn't just help in the moment. It doesn't just help give you tools. It actually restructures your brain. This is extremely beneficial for anyone who's struggling with borderline personality disorder traits, PTSD, even depression, ADHD, and OCD. If you struggle at all with emotional regulation, whether you express that internally or externally, dialectical behavior therapy is extremely helpful. And the other thing that I love about it is it really helps you speak up for what you need in real time. Oftentimes when people get triggered, everything that we've learned goes out the window. A lot of the women that listen to this podcast are extremely self-aware. They know exactly what they need to do, what they need to fix. They're going to the gym, they're going to therapy. But the moment they get in a situation in real time where they're triggered, it's like everything goes out the window. They either start blaming themselves and start spiraling, or they are reactive. So dialectical behavior therapy is extremely helpful for that. And again, after just 1 year, up to 88% of people no longer even meet the criteria for BPD after treatment. So not only is BPD not a death sentence, it is extremely treatable, and it is one of the most well-researched and evidence-backed healing modalities that exist out there in the psychology world. So if that didn't help enough, it also changes areas in the brain like the anterior cingulate cortex, which is involved in emotion regulation and impulse control, which is so important. It's also being used for PTSD, eating disorders, and other high-risk behaviors that are associated with adolescence, which is also beneficial because if an adolescent gets into dialectical behavioral therapy early, it can do its job early enough to help restructure the brain and help support them as they grow up and grow older into these other phases of their lives. Also, in case anyone is interested, I have a DBT-inspired workbook that really outlines these tangible tools and DBT healing methods for you to use. So if it's something that you're interested in and you're not quite ready to commit to a full course of dialectical behavior therapy, maybe your insurance doesn't cover it, maybe it's just not in the cards right now with your schedule, I have a DBT workbook that I've created to really help people just like you in real time have the tools and also self-reflect on actually what your needs actually are and how to speak up for them. So this is going to help a lot with ending people pleasing, setting boundaries in a way that feels safe for both you and the person that you're speaking to, and also just help with those real-time emotional regulation tools. So if that's something that you're interested in, go ahead and check out the link in my bio and my link tree, and you can find it there. But I digress. Let's go ahead and get into our episode with expert Mallory Gollick. Thanks so much. I hope that you enjoy.
Hello, everyone. Welcome to Not So Dumb Blonde. I'm on a mission to help women stop trying to fix themselves and start understanding themselves by relearning how to not suppress or explain away their feelings and needs through evidence-based healing modalities, conversation, and community. So whether you're navigating relationships, career stress, healing from your past, or simply just feeling overwhelmed by your inner.
Hello, everyone, and welcome back to Not So Dumb Blonde. I'm your host, Caitlin Gilner, and today I'm with Mallory Gollick. Mallory is a licensed professional counselor and the owner of Green Couch Counseling. She specializes in providing dialectical behavior therapy, DBT, to individuals and groups. In addition to her clinical work, Mallory offers DBT training and supervision to master's level interns and licensed clinicians. She is passionate about providing evidence-based care and education to help reduce the stigma surrounding borderline personality disorder and emotional sensitivity. Mallory is committed to helping clients build practical skills to navigate life more effectively and create a life worth living. Hello, Mallory. Thank you so much for being here.
Thank you so much for having me. I'm so excited to be here.
I know, me too. And for our listeners, I have been in contact with Mallory before. I actually did her dialectical behavior therapy group a few years back, and it was absolutely life-changing, which is why when I thought of DBT and how important this podcast is for reducing stigma, particularly around trauma and borderline personality disorder, she was the first person I thought about. So, Mallory, I would love for you to just tell listeners a little bit about who you are and how you got to where you are today.
Yeah, I'd love to. I own Green Couch Counseling, which is a group practice in Denver. We have a couple of offices located here, and we do a lot of services via video telehealth as well. Our group practice was formed out of my love for DBT. I was trained in DBT about 13, 14 years ago. I had a supervisor at an agency I was working at, and she was a DBT queen and taught me everything and trained me and kind of got the path rolling on DBT. And then when I started a solo private practice, we started running DBT groups out of my tiny little office, and we needed more space, and Green Couch Counseling bloomed from there. So now at Green Couch Counseling, we have 4 groups a week that we offer. We have a team of DBT clinicians here. We train master's level interns in DBT. We do a lot of coaching of other clinicians that are learning DBT or using DBT in their practice. It's really a passion of mine that I love, and I'm so happy to get to talk about DBT with you today because I could talk about DBT all day.
Yes. Oh my gosh, I love it. And it's just such an intricate process, and there's so much that goes into DBT, and I think there's a lot that a lot of people just don't know about it, right? I feel like we talk a lot about cognitive behavior therapy and other modalities, but DBT I just don't see circulating around quite as much. So I'm really excited to kind of let people know what it really is. So you mentioned you're super passionate about it. What in particular led you to DBT specifically, aside from other healing modalities?
One thing I love about DBT that I think really helps clients learning DBT is that it gives you a skill set to take home with you and apply in your environment. And I do a lot of talk therapy as well. I'm also EMDR trained, and there's so many wonderful modalities out there, but DBT really fills the skills gap of like, okay, we had this great conversation. I have this great insight about myself, but how do I actually change? And DBT is that skill set that's kind of fills that gap between insight and change. So I really loved it for that reason, that I felt like I had some tangible tools I could send people home with, and they could try in their own environments, and they can try in their relationships, and then we can kind of problem solve. How are they working? How are they not working? And the other part of DBT that I really love is that one of the cornerstones of it is validation. You know, we're taking a highly stigmatized disorder, borderline personality disorder, and we're validating that, you know, you're a highly sensitive individual, and DBT can help you harness that sensitivity and be really effective and use that sensitivity for you instead of against you. And so being able to relay that message to clients that, you know, we're coming into my office feeling shame about having the label or the diagnosis of borderline personality disorder, or even not having that label, but feeling shame about behaviors that were coming up because of trauma or depression or bipolar. and being able to give them messages of we can work on this and we can harness it so it works for you instead of against you. And it's not something we have to get rid of.
Man, you brought up so many good points there. And that's perfect because what this podcast is truly about is helping women feel confident in who they are. And instead of trying to shrink themselves or try to change how they're feeling or feeling ashamed for it, finding ways to harness it and manage it in a healthy way. And you brought up a couple good points. You mentioned the stigmatized diagnosis of borderline personality disorder, which is, what DBT specifically, was kind of created for. Would you mind going into a little bit more of the history of DBT and how it supports borderline personality disorder, but it's not only for borderline personality disorder, right? Okay.
Exactly. Yeah, DBT was created by Marsha Linehan. She's a professor, PhD at Washington University. And she created DBT a lot from personal experience. She has a great memoir that's out called Building a Life Worth Living that kind of goes into her experience with the mental health system and feeling invalidated and feeling like she kept hitting roadblocks that no one really had the answer of how do we treat high emotional sensitivity and borderline personality disorder. So she really set out to create this concept of DBT and theories around how does BPD develop in a personality. And she created DBT. And since we've had a lot of research around DBT and who it's helpful, and you're right, it was originally created for folks that had high suicidality and folks who had BPD. It's since developed into our research showing that DBT can really be helpful for anyone. We see a lot of common traits that are in BPD that are also in depression. If it's lower emotions, kind of like too much brakes on the emotions, we see that in depression as well. When we're looking at the arousal systems, we see that what happens in folks with BPD and emotional arousal is also happening in folks with trauma. So a lot of our research shows that DBT can be helpful with BPD, bipolar, depression, trauma, anxiety. I start all of my classes off with DBT can really be helpful to anyone and everyone. It's a skill set that's not taught in schools. For many reasons, there's a lot of gaps in parenting that these skills aren't taught to kids.
Yeah.
I've used it in my own life. I've taught it to friends, family. It's just invaluable set of skills.
I agree. I think DBT is really special. And I know that there's a lot of, people who may struggle with some of the symptoms or some traits that may feel familiar or similar to BPD, but not quite actually be BPD, right? And I just don't want anyone to ever feel like that means that they might not get benefit from it or like they can't be helped because they don't have the BPD diagnosis. And that's what I think is so great about DBT is just that it can really be applied for anyone. Who do you typically work with and what patterns do you see in women who feel emotionally overwhelmed?
Such a spectrum of what brings people into DBT. Some of the common factors we see are, of course, relationships, instability in relationships, chaotic relationships, anger outbursts in relationships, and wanting to work towards how can I be more effective in these relationships? How do I maintain my self-esteem? How do I create longer lasting relationships or a secure attachment in relationships? That's one of the main reasons folks come in. And then we do see, high number of folks coming in with suicidality or self-harm. And one of the cornerstones of DBT is building a life worth living, right? So we're creating insight into who we are. How do I say yes to something? How do I say no to something? Why am I saying yes and no to things? What boundaries are important to me? And so building that life worth living is really individualized. My life worth living is different than your life worth living. And so in DBT, we really work on identity formation and problem solving skills to help with suicidality, self-harm, impulsive behaviors. And I always tell folks, we have folks that come in that are in the C-suite of a company, and I've had everyone in between that are homeless and looking for housing. Like it does not discriminate, like anyone and everyone can benefit from DBT.
Absolutely. Absolutely. And that's one thing too, I hear, for people listening, it doesn't always just have to be one healing modality that works for you, right? DBT plus EMDR to help process some of the unconscious emotions could be, super helpful as well. And it sounds like you do both. So that's really exciting. But one of the things that I also love about DBT, and I'm curious what your thoughts on this are, is that a lot of times people will do a lot of work on themselves to be better. They're journaling, they're going to therapy, they're doing everything that they can. But then as soon as they feel triggered and they're in the moment, it's like everything goes out the window, and that can feel particularly discouraging. Is that something that you find common? with some people that you work with in your practice?
Absolutely. It's all about repetition, right? So we learn the DBT skills when we're regulated. So when our frontal lobe is online and we can follow instructions. And because when we're dysregulated and we're in that emotion mind, we don't have our frontal lobe to be able to follow instructions. So we want it to be kind of second nature to be able to go through these skills that we've already practiced before when regulated. And that takes practice. It's all about repetition and using these skills over and over and over. And, hindsight's 2020. So we track our skills use and we track what's helpful and what's not helpful for exactly this purpose. And, DBT individual therapists can sit down and go like, what's our missing link here? Like we have kind of our instructions of what we want to do when we're feeling that way. And here's, the facts of what happened when you were feeling that way. So what do we want to put in place? So next time we feel more effective in that situation.
I love that. And I would love to hear a little bit more and have you explain to listeners the 3 different parts of DBT and kind of how they all tie together.
The different skill sets.
Yes.
Yeah, absolutely. So DBT is made up. The way our company runs our DBT classes, we have 3 modules, and there's 4 skill sets in DBT. So the 3 modules are distress tolerance skills. So those are our crisis survival skills. So these are the skills that we can use when we're in a highly emotional situation and we don't want to make the situation worse or create more problems. So we might not necessarily regulate our emotions, but we're going to at least tolerate the situation until the situation changes. Maybe our emotions do go down, but we get to a place where we can problem solve. So those are our distress tolerance skills. We also have emotion regulation skills. So that's when, if you think of emotional arousal on like a 0 to 10 scale, we're regulated, we're able to follow instructions, but maybe we're kind of starting to spiral a little bit. We're kind of climbing up the ladder on that intensity. And so we're looking at getting in touch with reality, checking the facts. We're going, how can I be most effective in this situation, and using opposite action? Or we're able to elicit problem solving skills, right? Can I change my environment? Can I set a boundary? How can I problem solve the situation so I feel effective walking away from it? Our third set of skills that we go over are interpersonal effectiveness skills. And those are learning what our priorities are in different interactions. Is my self-respect the priority? Is the relationship the priority? Or is a goal that I have in this situation the priority? And how am I constantly shuffling those priorities around to take care of myself, relationships, and my goals and getting my needs met? And we talk through scripts for that, identifying emotions. When do I hold a boundary? When do I say no? When do I say yes? We go through all of those skills. And then our 4th set of skills that we sprinkle into all 3 modules, because they're really our foundational skills that you need for all 3 modules, is mindfulness. So we go through mindfulness skills. What do you do when being mindful, and how do you do it? Different states of mind, emotion mind, where we're filtering the world through emotions, versus being in wise mind, and how that feels in our body and what that looks like. So those are our 4 sets. Distress tolerance, emotion regulation, interpersonal effectiveness, and mindfulness skills.
Thank you for going through all of that, because it's all so helpful. And for listeners, DBT is also really cool because, and I remember when I was doing it, if you are the type of person who needs like something tangible, and maybe talk therapy is helpful, but you want something that feels a little bit more guided, it's the group classes that Mallory had offered that I joined in on felt like a class, like it was a course. It was, you were completing certain modules. And so to me, that felt very different than any type of therapy that I had received before, which is what made it particularly interesting. Another thing I wanted to point on is, a lot of the women in this community do really struggle with feeling like they're too much, too sensitive. And they do really struggle with knowing, okay, is this my feeling? Is this worth bringing up? Should I bring it up, or should I not bring it up? And from my understanding, from what I remember, DBT really does go through some of that. Is that something that you have found to be common among women in your practice, particularly in relationships?
Yeah, women are taught not to take up space. And we're also taught that our emotions are too much. And so DBT really works on how do we express our emotions and take up space, because we're allowed to take up space and we should take up space. But how do we do that effectively so we get our needs met? So we feel heard, we either feel validated or we can validate ourselves, and we're not feeling dismissed or invalidated.
Yeah, and feeling good about it afterwards, right? Because sometimes when we get triggered, and especially individuals who maybe have BPD traits or struggle with CPTSD, they may react in a way that they instantly feel like shameful about, right? And so, what I love about DBT is it gives some of those tools to where you can speak up for yourself and leave the interaction being like, damn, I just did that. Like, I feel good. It was safe for me and it was safe for the other person. So, that's awesome. Thank you.
Yeah, I took up space in a way that maintains my self-respect and maybe got a need met, or maybe I set a boundary, but I'm walking away from it feeling like I maintained my self-respect and it was an effective way of doing it. I didn't spiral and scream and yell to get my needs met, but I was able to hold a boundary and express myself effectively.
Yeah, not needing to over explain and spiral in that way, right? To feel heard. And I found that oftentimes the reason why a lot of people don't speak up or set boundaries is because, of course, they're afraid of what might happen. How might the other person react, right? And so I've also seen in some DBT work as well that it really does focus on, the likelihood of helping a person frame getting their needs met in a way that the likelihood of them getting their needs met is much higher, and it also feels safer for the other person too. So I just can't stress enough like how wonderful I think DBT is. What
Yeah,
are
we also talk about, at best you get your needs met, but if you don't get your needs met or someone says no, how do we cope with that?
so
We don't
important.
create a new problem.
Exactly, because that's the hardest part. That's amazing. Yeah. What are some common triggers that you see come up in relationships?
Common triggers, that's such a good question. Depends on stage of relationship, certainly. I think for women specifically, see, I think we'll start with dating relationships. I think in dating relationships, it goes to exactly what we're just speaking about. How do I take up space? How and when do I get to express my needs? How do I say no? How do I know what I want in relationships? And, dating is a big part of dating is you date to learn what you want and don't want in relationships. But what's so important is dating is being able to say no, being able to set a boundary, and also having the skills to break up or end it with someone. That's a really hard thing to do. And oftentimes relationships go on and on and on because someone just doesn't have the skills to be able to say no, or to be able to say this isn't working from me and walk away from it not feeling guilty. Because as women, we're taught to feel guilty.
Mm.
So dating relationships, I think it's really important to have those interpersonal effectiveness skills, that dear man skill of being able to end the relationship, or to be able to say no or set a boundary of what's okay and not okay for you in relationship. And feel proud of that. And feel proud that you set a boundary, and deserve to be in a relationship with someone that respects your boundaries and doesn't try to push your boundaries. Once people are in relationships, a lot of the skills we work on is reality acceptance of what the relationship is versus what we want it to be. Are we accepting the relationship for what is actually happening in the relationship, or are we holding on to a relationship that we're hoping changes or wish changes? And really kind of facing that reality of the facts of what is in relationship. So there's a couple examples.
That's so good and very true. And I feel like some of those things we don't talk about enough. How can someone tell the difference between their intuition and emotional dysregulation?
Ooh, that's a hard one. That's
Isn't
a
it
really
so
hard one. I
hard?
think it takes practice for sure. In our mindfulness skills, we talk about different states of mind. And we have 3 states of mind that we talk about in DBT. We have our rational mind, which is very fact-based, right? Emotions, values aren't considered in that. The opposite of our rational mind is emotion mind, and that's ruled by emotions, right? It's kind of like if you're feeling anger, for example, if you're in an emotion mind with anger, it's kind of sitting on your face and you're filtering the world through anger. Our goal in DBT is to kind of synthesize the two of them, bring them together, and get to a wise mind state of mind. And when we're in wise mind, you can kind of feel that in your body. One of the analogies that Marsha Linehan uses that I love is she talks about, learning what your wise mind is and finding that in your body is kind of like fine tuning a radio. Like you might go too far this way and it gets a little staticky, and then you go too far towards emotion mind, it gets staticky, and eventually you fine tune it of, oh, there's my wise mind. And so I think when you find wise mind and you can operate from a place of wise mind, you can feel that intuition. You can feel like I'm acting effectively from here. And that's my intuitive state. And so in DBT, we really work on finding that difference between emotion mind and wise mind to work on intuition versus emotion. Like, how does it feel in my body when I'm in emotion mind versus how does it feel in my body when I'm in wise mind?
So good. And how would you say that black and white thinking might contribute to dysregulation?
Yeah, when we get into black and white thinking, well, in relationships specifically, we can often start to assume motives in people, right? And it never feels good when someone makes an assumption about your motives to do something, especially if it's a motive that's looked upon poorly, right? That doesn't feel good, and that can create conflict in relationship. What did you ask?
I was just thinking because you had mentioned that, there's this wise mind or middle path, right? And it just kind of made me think a little bit about how a lot of times when people have suffered from trauma, there's a lot of this black and white thinking. And so DBT, from what I understand, really focuses on this idea of two things can be true at once and trying to minimize the black and white thinking. And I think it helps a lot with dysregulation, right? Yeah.
Absolutely. Yeah. Yeah. We're really working on in DBT that mindfulness piece of being present in reality and letting go of judgments. If we have all or nothing or black and white thinking, so we're thinking like, this is good, this is bad, you always do this, you never do this. It's probably not true. There's probably not an always or a never. There's some sort of gray area in between. And when we're operating in those black and white, all or nothing thinking, it can block problem solving. It can block certain set of emotions. It can lead us towards anger because we believe so strongly it's only this one way, when there's a lot of other options for how it could be. And that can block empathy for others. And it also blocks problem solving. So in DBT, we really work to find what's that gray area between all or nothing, trust and no trust, acceptance and change. What's that gray area look like, and how can we be more cognitively flexible?
I love that. That's so important. Can you walk us through what a typical emotional spiral would look like and how DBT might be able to support with that step by step?
Sure. Emotional spirals can be triggered either externally, so, something in our environment, or it can be triggered internally, right? We might have a thought, we might have a body sensation, it might be an emotion. It might start with an email from our boss that makes us fearful. And that feeling of fear in our body then triggers that emotional spiral. One thing we say in DBT is that emotions love themselves. They just keep coming one after another. And so we talk about in emotion regulation, what is an emotion? And if you read research on emotions, there's a lot of different theories of what an emotion is. In DBT, we really conceptualize that is that emotions start in the body, so you can feel it in your system. And then what the external world's responding to is your facial expressions, your body language, and what you say or what you do. Okay. And so when we have those emotional responses, we really have to think about what's the external world responding to. Like, I might feel sad inside, but I'm screaming and yelling. And so someone's like, can you stop being so angry? That can feel really invalidating because I'm not feeling angry. I'm feeling sad. So we really talk a lot in DBT about our expressions and how we express emotion. Remind me of your question. I'm sorry.
No, that was perfect. It's just
Go on tangents.
no, and we love that. That's what we want. I'm here for it. I'm so here for it. No, it's just like, I think typically a lot of, times when we start spiraling in relationships, like you said, it's just like a train that doesn't stop. And I think that would you say that people who are maybe struggling with BPD or BPD traits, that it is treatable and that they can go into remission with DBT?
Yeah, I think that is a common theory with DBT is that folks coming in with borderline personality disorder, with suicidality, self-harm, with DBT and applying those skills to your environment, we can see change that puts a lot of the traits, if not all of the traits someone's experiencing, into remission.
I love that. I just think it gives people so much hope because a lot of times people who are struggling with CPTSD or BPD traits, it can feel really like it's never going to end, like there's nothing that can be done to help. And just knowing that DBT is out there and it's known to be effective is just really helpful.
Yeah.
What are some specifics around like maybe 2 to 3 DBT skills that someone can use in the moment when they feel triggered?
Ooh, good one. Okay, I'm going to do one from kind of like each module. I think that will be
Perfect.
helpful.
I love it.
We'll start with distress tolerance. The first skill we teach in distress tolerance is the stop skill. This is going to sound really simple. And the reason it's so simple is that you have to think if you're extremely dysregulated, so let's use shame. You're in kind of like that shame spiral. Again, your frontal lobe's not online. And so we need simple. Okay. And the stop skill is exactly what it sounds like. And it spells out stop. So the S stands for literally stop. And we want you to stop all your muscles. We want you to stop talking or texting, whatever you're doing, just freeze and stop. The T stands for take a step back. And so you can literally take a step back if that's possible. You can lean back, you can put your phone down. The O stands for observe. Observe is one of our mindfulness skills, and we can observe with the 5 senses, right? So we can see, hear, taste, touch, smell. If we can observe it, then it's in our present reality. So that helps us get present and not in the past or not spiraling about the future, but just present in what's happening in this moment. And then the P in stop stands for proceed mindfully. And that might happen in a minute of starting this skill. That might happen in an hour or a day. There's no timeline on when you can proceed mindfully, but you want to think about this situation that's triggering me. How can I be most effective? And effective is how can I get my goals met in this situation? So that's a distress tolerance skill. An emotion regulation skill. Opposite action is a great one. It's exactly what it sounds like, acting opposite to the emotion that you're having. So when we experience an emotion, we have action urges with it, right? So let's take anger, for example. Our action urge with anger is generally to lash out or lash in internally, beat ourselves up. And we want to do the complete opposite of that with our mind, body, and soul. And so if my action urge is to, lash out, then I might sit down in a chair and take a deep breath, do something completely opposite to that. If my action urge is to beat myself up, then I might do a loving kindness meditation, totally opposite to it.
I love opposite actions, my favorite.
Is it? Do you use it in your life?
I do it all the time and especially when you think about like relationships too, I'm just thinking of examples like, if one may identify with having more of an anxious attachment style and needing a lot of reassurance, the opposite action would be to do the opposite and maybe pull back a little bit because their normal reaction would be to, externally process and to get reassurance met. And then the same to be true in relationships with someone who identifies with maybe withdrawing more or more of an avoidance. The opposite action would be to lean in a little bit more. And what's wild is before I knew about DBT when I was younger, I started naturally doing it on my own. I don't know how it happened and it changed me. And then I came into DBT and I was like, wait, that's an actual skill that they're teaching. And it just makes it easier because it kind of just eliminates trying to figure out what to do because you're just do the opposite. Just replace that with something else. And it was very effective.
Yeah. It's something we commonly hear, especially with opposite action, is like, wait, I've done this in my life before. We're always like, yes, give yourself credit for being effective in your life. And we have that insight into like, oh, this is actually an effective technique that I've developed and I can use. And now I'm aware of it.
Exactly. And I think another great example of that, and one thing that I learned and from my therapist that I'll never forget is she always said that, when you get angry, that's a secondary emotion. When you get angry, ask yourself, what are you avoiding feeling vulnerable or being vulnerable about? And so to me, that was kind of another example of opposite action because I used to get like, I was a little spicy, and so the moment I felt like I was vulnerable but didn't want to be vulnerable, I would just get angry. And so I immediately learned to tell myself, okay, wait, what are you avoiding right now? Like, what are you afraid to actually say? Which normally is, I feel scared or, I'm sad that this is happening right now. And so that can also be used as opposite action, right?
Absolutely. Yeah. Ask yourself, like, what's the threat?
Mm-hmm.
Or what's the catastrophe? And if that catastrophe does occur, how can I cope with it?
Yeah, I love that. That's another thing I learned in your course was like, because, if we get anxious about what can happen, one thing that the group taught me or that you taught me was sitting with, okay, what if the actual worst case thing did actually happen? What are you going to do with that? Let's get comfortable with that. And that also changed my life.
Yeah, because, speaking to opposite action, and this kind of goes with our check the facts skill. If we are wired to avoid, our brain doesn't go to what's the worst case scenario here and what am I going to do about it? We just avoid even thinking about that. That doesn't feel good. That feels really hard to tolerate, the anxiety that comes with thinking about the worst case scenario. What we find is if we can get in touch with what's the worst case scenario and how are we going to cope with that, it actually becomes more acceptable. And, we also ask people on a 0% to 100% chance that worst case scenario is going to happen. It's usually a lot lower when they get in touch with it and actually think about it, but they're responding to it like it's actually going to happen.
Absolutely. Just like a little scenario. So say there's a woman in a relationship who's really struggling, feeling safe. She's feeling dysregulated. She likely has, had a lot of trauma in her life and she's really struggles to trust. And she's spiraling a lot in the relationship, not really able to be present because she's just wondering, whether maybe a good example would be she's afraid that her partner is going to cheat on her. And
Okay.
it's something that she's very highly obsessed with. How would DBT help support that individual?
Yeah. The mindfulness skills are going to help keep her present in what's actually happening versus what she's assuming is going to happen or could happen. It maybe has happened in the past, right? And I always call it like a faulty smoke detector, right? It's like our amygdala and our brains, like this is happening when it might not actually be happening. The skill I would want to teach her is checking the facts. What are your thoughts? And what is your brain telling you is happening? Okay, let's suss out all of the facts from that. See, hear, taste, touch, smell. What has your partner told you? Are you assuming that when they are home late from work that they're doing something they're not supposed to? Or do you have facts that they're not supposed to be doing that? Do you have a fact that they had a business meeting that ran late? What are assumptions? What are our emotional reasoning? Kind of going through all of those thought distortions. And then exactly what we were just speaking to, what is the percentage, 0% to 100% chance that happens? If our worst case scenario is that your partner cheats on you, how are you going to cope with that? Who are you going to call? What are you going to say to your boyfriend? Are you going to leave that relationship? Are you going to stay in the relationship and work through it? May not know till you're in that situation. But kind of going through all of those scenarios. And when we get so kind of pigeonholed into thinking that's going to happen, we're also missing a lot of great things that might be happening. So we're also trying to open up some flexibility of what are other options? And that's part of that checking the facts skill too.
Yeah. And I love that. And the truth is, like, it could happen, right? And
Sure. Yeah.
that worst case scenario thing is kind of like building the trust with yourself of being like, okay, if this happens, I trust myself that I can get through it because I've already kind of assessed what my plan would be. So I think that that's great and helping ease, some anxiety. How do you think that, what would you say to someone who understands these skills? Maybe they've done DBT, but they're really struggling to apply them in real time.
That's one of the hardest parts. When we're in the skills training classes, like you said earlier, we run it much more like a classroom than a psychotherapy processing group. We're not processing. We save that for the individual DBT therapists. Our goal in the DBT skills training classes is to learn these skills and use the group to talk through the skills, to come up with ideas of how to use them, what's working, what's not working. But for someone who goes through all of the modules, throughout that, we're keeping what we call diary cards. Diary cards track behaviors we want to decrease that are ineffective in our life, emotions, and then all of our DBT skills. And the purpose is to find patterns between emotions, behavior, and skills, but also they're a huge tool once someone finishes the class portion of DBT. The diary card has all of the skills listed on it. So it's a constant reminder of here's my skills. Everyone develops kind of like their go-to skills that they've learned that are really helpful in decreasing behaviors. But over time, life is going to life and things change and we might need new skills. So it keeps it fresh in their memory. We have a lot of folks that finish DBT and come back for a refresher. I certainly recommend working with an individual DBT therapist, but the diary card really is that link between the skills training classes and continuing that into your environment.
And being able to see how things are changing over time and seeing the progress and being able to give yourself credit for some of that progress that you're making. What would you say, in your opinion, successful repair looks like after a conflict? I know, big one.
That's a hard one. Successful repair, it's focusing on yourself, I'm focusing on like, here's what I want to do differently next time. Here's how I could be more effective. It's taking blame out. And that's really hard, is not blaming each other. Women, as we talked about earlier, we're not used to taking up space. And women often over apologize. If we apologize, we're admitting we did something wrong, right? If we screwed up, then of course we want to apologize. and take ownership of that behavior and commit to what we're going to do differently next time. But we don't have to apologize if we didn't do anything wrong.
That's such a good
But
point.
we do want to take ownership of here's what I'm going to do differently next time. In DBT, we have what's called a chain analysis, and that's looking at, I want to decrease this behavior. Here's vulnerability factors that can lead to being vulnerable to that behavior. And this is a long skill, so I won't go through all of it,
Yeah.
but if that behavior happens again, then we can look at, like, what do I do differently? How do I repair with my loved ones? And how do I repair with myself as well? Like, we also
Yeah.
have to forgive ourselves and take care of ourselves when repair is warranted. But, it's vulnerable to apologize. It's a hard thing to do. And we talked about that in our interpersonal effectiveness skills.
It absolutely is. And for a woman or anyone, it doesn't just have to be a woman, is trying to, for example, express a need or how they feel. Can you go over one of the skill sets or tools or kind of explain how one might go about expressing that to someone?
Yeah. In our interpersonal effectiveness skill set, we have what's called the Dear Man. I think it's one of the most kind of well-known DBT skills. People are like, oh, I've heard of the Dear Man, but they don't know what it is. The D in Dear stands for describe. So we're using just our facts to orient someone to what we're talking about, right? We can like dive into a beautiful want, need, boundary. But if we haven't oriented someone to what we're talking about, they're like, what? What are you talking about? So the describe is just beautifully orienting someone to why we're here, what we're talking about. The E in Dear stands for express. So we're expressing ourselves. I feel, it makes me feel this way. The A stands for assert. This is where women get tripped up. We forget the assert. We say, we have this beautiful describe, the facts. When you came home late from work the other day, I felt scared because I didn't know where you were. And the partner goes, okay, I won't do that again. But what we didn't do is assert what we want or need in the future if that's to happen. So an assert might sound like, in the future, can you call me if you're running late? Assert is really, really hard. And it's something in DBT we work on reworking and reworking. It's not blame, but it's asking for a need. It's asking for our expectations in relationships. Like we talked about earlier, we date to learn what we want and don't want in relationship. And we have to be able to assert that to a partner too, because nobody's perfect. Our partners are not perfect, but they need to know what we want and need from them. And that's what that assert is. And the R is the reinforce. It's kind of like explaining to someone, how will it help the relationship if you do that for me? So if we assert, can you text me if you're running late? The reinforce then would sound like, and our partner's like, of course, I apologize. I didn't let you know I was running late. Our reinforce might sound like just a simple thank you. Or it may sound like, if you do that in the future, then I won't be so worried and stressed when you come home and we can enjoy our evening together. So it's kind of like, what's the carrot we're dangling from their face for them to do it for us to healthfully strengthen the relationship.
Yeah. And then the man part.
The man part the man part is more kind of like our demeanor and what we're doing. So being mindful, not using threats or attacks. And the N, and it stands for negotiation. There might be times, depending on the relationship and the situation, where we're really willing to negotiate. Sometimes we're not, but sometimes we might compromise with someone. So we want to think ahead of like, what are my compromises? What am I willing to do? And what am I not willing to do?
Oh, that's so good. And what I love about it too is, like we said, a lot of these skills are also created to help you actually get your needs met too. And so that's kind of that last piece where you mentioned kind of dangling that carrot and being like, if you do that, I will be a lot less worried and maybe throw in a little bit of humor and less grumpy when you get home from work. And you know what I mean? And so it's a good way to help you actually get your needs met too, not just expressing feelings for no reason. It's like, it can actually work.
Exactly. Yeah. And we talk about in DBT, like, humor goes a long way. Like, you can use humor. We're having hard, vulnerable conversations, and obviously they're serious and we want to take them seriously, but we can use humor to lighten the mood.
Absolutely. Yeah, absolutely. So what would you say, for women who are feeling like they are too much, what advice would you give them?
For women who are feeling like they're too much, I think we have to look at boundaries. Are you comfortable setting boundaries? Are you comfortable saying no? Which really comes down to those communication patterns. Are you comfortable being assertive? And if not, let's learn a skill set to become assertive and not feel guilty about it. We have to recognize that this is a cultural pattern. In our culture, women are not taught to take up space. They're not taught to be assertive, and we have to learn that as adults. And DBT is one of those skill sets that can help you learn that and not feel guilty for learning it.
Well, 100%, 100%. So, for someone listening to this who's really interested in getting into DBT, DBT therapy, what would you recommend their next steps be?
Yeah. So DBT is best learned in the class. It's a lot to learn on your own. DBT kind of has its own language to it. As we talked about, there are so many skills within all of those 4 skill sets that we talked about. And so it's best learned in a class because we go through Marsha Linehan's material skill by skill and kind of chunk it out in a way that feels manageable. People do learn it on their own, and there's a lot of great resources out there to learn it. But I recommend doing a skills training group just to have people alongside going through similar things with you, having a skills trainer to teach it, explain it. And then also you have the practice work to implement the skills into your environment, which is really helpful. We can learn all the skills and intellectualize them, and people can gain great insight from that. But then we see that gap of actual change when they don't implement it into their environment. So start with a skills training group. And a DBT individual therapist can help then personalize that information and individualize it to your life.
Mm.
At our company, we don't require people to have a DBT therapist. We open communication with the individual therapist that someone's working with, but we don't require them to work with one of our DBT therapists. So most therapists can, look at a diary card and help you put those pieces together and help implement the skills. But I think the individual therapy piece can be really helpful as well.
Yeah. Would you say that there's a difference between a therapist who's doing dialectical behavior therapy inspired work and then someone who's actually trained in DBT?
Yes, all of the skill sets are so intertwined with each other. You really have to know all the skills and kind of the theory behind the skills. Marsha Linehan has so many pearls of wisdom on her theories behind borderline personality disorder and DBT and how it all links together. Traditional DBT is taught as, like a classroom setting, like we talked about. It's not a processing group. And people can pull nuggets of DBT into different groups, and it's very, very valuable. But if you want to do true DBT, you need to find someone who is trained in traditional DBT from Marsha Linehan.
How long are the modules and what does it look like as far as consistency?
There's different ways to teach it. So one of the factors is the level of care. Our level of care is outpatient, and we work with adults. So it looks a little bit different between adults and adolescents. And you can do it kind of depending on how long the class is. We do each module 7 weeks, and it's once a week for an hour and a half. I have worked in other places that do 8 weeks for 2 hours. So you'll see it kind of varying. What's most important is that they're using Marsha Linehan's material, and that, again, it's that classroom setting that we're focusing on skills. We're not focusing on processing.
Yeah, and for everyone listening, half of the reason why I feel like it's so effective is just the repetition of it, right? If you do one module, I mean, it's very structured. And so again, everybody works differently. For me, having the structure was absolutely incredible for building up the skill sets. So I really love that that's kind of what I noticed when I was in your group. Where can people find you if they're interested, whether they're in Denver or somewhere else in the world?
Yeah, our group practice is Green Couch Counseling, and on our website you can see all of our groups and classes that we offer.
Wonderful. And so you do virtual and in person, correct?
We do. Mm-hmm. Yeah.
Perfect.
Yeah, and we're getting ready to start a family and friends group. So it's
That's exciting.
kind of family and friends supporting folks that are experiencing emotional sensitivity or borderline personality disorder or are in a DBT class. How can you support a loved one? So we're getting ready to launch that soon.
Wonderful. I'm so
Yeah.
excited to hear about it. Is there anything else that you want to share with listeners before we wrap up that maybe you didn't get to share already?
Oh, I was just so excited to get to share DBT knowledge. One of my favorite parts, I tell all my classes this when I start it, is like, I wish I could unload like my DBT files, to them. And it feels so lucky to get to share the DBT knowledge with people. You just see light bulbs go off and people find a sense of hope that there is something that can help them. And also in our classes, to be in a group of people with shared experiences is really powerful. So I feel so lucky to get to do this work, and thank you for having me.
Thank you so much for sharing the word and for everything that you're doing. I truly think it's very helpful. It's definitely changing lives, and I appreciate you being here. Thank you.
Yeah, thank you.
Thanks so much for listening.